A neighborhood struck by grief after an explosion ripped through a crowded COVID-19 ward. Saad lost his father, who had been a patient at the hospital, as well as his brother, who had stayed by his bedside to care for him.
My father was about to recover. They even took him off the oxygen, and then the hospital burnt down. I lost 2 of them. We couldn't rescue them.
The explosion at Baghdad's Ibn al-Khatib hospital, where around 120 patients were treated for COVID-19, was likely caused by a poorly handled oxygen cylinder. Doctors say the facility lacks basic equipment, including a central oxygen supply system, and that patients' relatives often handled oxygen cylinders because of a shortage of medical staff. Mohammed was there to attend to his elderly aunt when the blast went off, but he couldn't save her.
Everyone left behind the patients and just ran out. In a few seconds, the entire floor was ablaze with heavy fire.
Despite the risk of COVID-19 infection, there was no restriction on the number of relatives allowed in the wards, which further increased fatalities.
This is neglect from the hospital because you shouldn't allow anyone to enter. The family members are greater in number than the patients inside the ICU.
Witnesses say the emergency response was slow, while Iraq's Human Rights Commission told Al Jazeera the hospital lacked adequate fire safety systems.
We know very well that there is absence of occupational safety requirements, absence of confronting such fire in such buildings. When we look at on the official reports about such entity, we see there is no auto extinguishing system or firefighting system.
The Prime Minister has ordered an investigation and has suspended several officials, including the Minister of Health and the Governor of Baghdad. The deadly fire at the Ibn al-Khatib hospital has further fueled public anger over the government's handling of the coronavirus pandemic. And for many, it's a manifestation of the deeply rooted corruption that has crippled the healthcare sector. On Sunday, families began holding funerals, but few have hope for genuine accountability from the government or that the structural issues that lie at the heart of such accidents will be addressed.